Sensitive stomach. If you've ever taken your dog or cat to the vet or scrolled pet food packaging, you've seen that phrase. It's everywhere. And I'm going to say something a little bit controversial. It's the most overused, least useful phrase in pet care. Because sensitive stomach doesn't actually tell you anything. It doesn't tell you what's wrong. It doesn't tell you what to do. It's a label, not an answer. Today, I'm giving you the real answers. We're breaking down IBD, colitis, food sensitivities, leaky gut, and a few other conditions you've probably heard of but maybe never fully understood. So that the next time someone says sensitive stomach to you, you'll know exactly what questions to ask next. I'm Penny, and this is video 2 in our Digestive Deep Dive series. If you haven't seen video 1 yet, go back and watch it first. We covered the fundamentals of how digestion works, and everything today builds directly on that. Let's get into it. Before we talk about specific conditions, we need to answer one question first. Is this acute or is it chronic? Because that changes everything about how you respond. Acute means sudden onset. Your pet was fine yesterday, today they're not. The good news is, acute issues usually resolve within 24 to 72 hours with basic supportive care. What causes an acute flare? Most commonly, it's dietary indiscretion. This is just a polite way of saying they ate something that they shouldn't have. It can also be an abrupt food change, parasites, or a mild bacterial overgrowth. Chronic is different. Chronic means it's ongoing and it's recurring. We're talking 2 weeks or more, or a pattern of repeated flare-ups over time. And chronic issues are telling you something important. This isn't a one-time event. There's an underlying imbalance that needs to be addressed. Now, before we go any further, I need to say this clearly, because your pet's safety comes first. Some symptoms are never a wait-and-see situation. If you're seeing repeated vomiting, blood in the stool or vomit, lethargy, abdominal pain or bloating, a known toxin ingestion, or really any of these symptoms in a puppy, a kitten, or a senior pet, that means call your vet today. Not tomorrow, today. Okay, with that safety note out of the way, today's video is focusing on the chronic side. These are the conditions that don't have a quick fix, and they need a real plan. Let's start with one of the big ones. IBD, inflammatory bowel disease, is chronic inflammatory of the intestinal lining. In plain English, immune cells build up in the wall of the gut and keep it in a constant state of inflammation. Here's what it typically looks like in a real pet. Recurring vomiting and or diarrhea, weight loss over time, an appetite that comes and goes. And here's the tricky part. IBD often comes with stretches of apparent normalcy in between flares. Your pet seems totally fine for a few weeks, and then it's back. That pattern lulls a lot of owners into a false sense of security, thinking, oh, it must have been just something they ate. But if this is happening again and again, that's IBD asking to be taken seriously. Now, how's it actually diagnosed? The definitive answer is a biopsy, but in practice, a lot of cases are managed clinically. This just means, based on the symptom pattern, ruling out other causes and watching how the pet responds to diet and protocol changes. And speaking of, diet trials are usually the first step. That typically means a novel protein diet, something the pet has never eaten before, or a hydrolyzed protein diet where the protein is broken down into pieces too small for the immune system to react to. And here's the connection I want you to hold on to. The gut healing protocol we're covering in video 3 supports this exact same tissue. So even if your pet has a formal IBD diagnosis, everything we teach in this series still applies. Let's talk about 3 more conditions that get lumped into sensitive stomach, and they're actually quite different from each other. First, irritable bowel syndrome, or IBS. This one's interesting because it's a functional disorder. That means there's a problem with motility and sensitivity, how the gut moves and how it reacts. But you won't necessarily see visible structural inflammation on imaging or on a biopsy. And here's a direct callback to video 1. IBS is strongly linked to the gut-brain axis. Stress is a major trigger. If your pet's symptoms seem to clear around travel, boarding, a new pet in the house, or changing routine, that's your clue that IBS and stress might be connected for your pet. Second, colitis. Colitis is inflammation specifically in the large intestine, the colon, and it has some very classic signs. Mucus coating the stool, straining to go, a sense of urgency, and small frequent stools instead of one normal-sized stool. If you're seeing mucus on the stool regularly, colitis should be on your radar. Third, pancreatitis. This is inflammation of the pancreas, and it's often triggered by high-fat meals. Think table scraps, especially around holidays or barbecues, obesity, or certain medications. I want to be very direct here. Acute pancreatitis is a veterinary emergency. If your pet is in obvious pain, vomiting repeatedly, and won't eat, that's an emergency vet visit. Full stop. But chronic low-grade recurring pancreatitis is actually more common than people realize, and it's frequently underdiagnosed because the symptoms can be subtle. We're talking intermittent low appetite, mild discomfort. Maybe your pet seems a little off every few weeks. If that sounds familiar, it's worth a conversation with your vet. Okay, this next section is the one that trips up almost every pet parent I talk to. So let's slow down here, because getting this distinction right actually changes how you approach your pet's diet. A true food allergy is immune-mediated. Specifically, it's an IgE-driven immune response. A true allergy can cause both skin symptoms and GI issues, and it requires genuine avoidance of that specific allergen once you've identified it. There's no just a little bit is fine with a true allergy. Food sensitivity or intolerance is different. It's generally not immune-mediated in the same classic way. It's often dose-dependent, meaning a small amount might be totally fine, but a larger amount causes symptoms. And critically, sensitivities are closely tied to gut permeability and dysbiosis, not a fixed, permanent allergic reaction. Here's the insight I really want you to walk away with today. A leaky gut increases the risk of developing brand new sensitivities over time. That's the mechanism. This explains something a lot of you have probably experienced. A pet who seems to react to everything after a bad GI flare-up. It's not that they suddenly became allergic to the entire world. It's that their gut barrier is compromised and it's letting more triggering particles through than it should. Heal the barrier, and for a lot of pets, that reacting to everything pattern actually improves. Let's go deeper on leaky gut, because we touched on this briefly in video 1, and it's really the mechanism that ties the whole video together. Picture the lining of the intestine as a wall made of individual cells tightly zipped together at what are called tight junctions. That tight seal is what makes the gut a selective barrier. Nutrients get through, everything else stays out. Leaky gut is what happens when those tight junctions loosen. Once that seal is compromised, bacteria, toxins, and undigested food particles start crossing into the bloodstream, things that normally never would have gotten through. What causes those junctions to loosen? The list should sound familiar by now. Chronic dysbiosis, NSAID or steroid use, chronic stress, a poor diet, and infections. And here's the chain reaction that follows, step by step. Chronic immune activation, leading to systemic inflammation, leading to new food sensitivities, leading to skin flares, leading to joint inflammation. So here's the big picture takeaway I want you to really sit with. This is the exact mechanism explaining why gut issues so often show up as skin problems or joint problems, instead of or in addition to classic GI symptoms. your pet's itchy skin, their ear infections, their joint stiffness. The trail can lead right back to a leaky gut, even if their stool looks perfectly normal. 2 more conditions before we wrap up, and these are the ones I find people miss most often. SIBO. This is small intestinal bacterial overgrowth. And it's exactly what it sounds like, excess bacteria colonizing the small intestine, which should normally have relatively low bacterial counts compared to the colon. The result is bloating, gas, and malabsorption of nutrients. EPI is endocrine pancreatic insufficiency. It's inadequate digestive enzyme production from the pancreas. And EPI has a really distinctive presentation. Greasy, large volume stool, and significant weight loss, despite a normal or even ravenous appetite. That combination, normal appetite plus dramatic weight loss, plus greasy stool, is a big flag for EPI. Here's something important. EPI requires enzyme replacement therapy. Diet changes alone will not fix it. Both SIBO and EPI are diagnosed through specific testing. For EPI, that's a blood test called TLI. So if you're dealing with persistent, unexplained symptoms that don't seem to respond to diet changes, that's not a sign to keep troubleshooting indefinitely on your own. That's a sign it's time for a vet workup. Let's do a fast recap because we covered a lot today. Acute versus chronic, IBD, IBS, colitis, pancreatitis, the difference between food sensitivities and true allergies, leaky gut is the underlying mechanism, and SIBO and EPI is the malabsorption conditions people miss. And I want to say this clearly, the same way I do every time. None of this replaces a vet visit for a sick pet. But now you know what questions to ask. You know the language, and that changes the conversation you're able to have, because that's when whether that's with your vet or me. Next week in video 3, I'm giving you my actual step-by-step healing protocol. The exact 4-part framework I've used for over 20 years to help pets who are labeled hopeless sensitive stomachs actually heal. Subscribe so you don't miss it. And if you want to bring your questions about anything we covered today, I host a pre-live public Q&A on the first Thursday of the month. The link is in the description. I'll see you there, and I'll see you next week.